Broadcasting from the inner sanctum of human emotion. Just Got Personal. America's first competition talk show. You're in the hub.
I'm holding on your...
Good day and welcome to the hub. I'm your host, Joel Aaron. Stephanie, Jared, and Rich are our panelists on the show all week long. If you'd like to join us in the future, shoot me an email, Joel, Joel, at tvtownhall.com. You know, guys, the law of unintended consequences somehow, sometimes just has its day at the beach. And that was certainly the case, it seems, with the recent healthcare legislation that was passed out of Congress. We are now learning from the Congressional Research Service that some of this law may have had unintended consequences for some congressional representatives and senators and their staff. That they could actually be denied some of their federal health insurance coverage that they've experienced in the past, their federal benefits program, under this new law. And that they didn't really even determine a date when that might happen. So it can really go at any point here. And I guess they're saying right now that Iowa Senator Chuck Grassley last year in the this was in a Senate Finance Committee where he snuck this in. And I'm wondering if the man, you know, he was against it all along, if he just did this to spite the process. Jared, what do you think?
I think that it's really funny when, you know, some animals are more equal than others, and then it all just goes up in smoke. I think that's rather hysterical. Oh, well, we were going to, wait, no, it's not going to, we don't want this to apply to, no. But, oh, wait, it does? Are you kidding? How did they miss, I mean, you know.
How does this apply to us?
Yeah, how did they not find that in the bill? It's only 2,000 pages. Did they only go through the first one, you know, 1,500? Was it on page 1999? Was it buried in the middle? Was it divided into two parts and referenced in three areas? I mean, you know, I thought they read all this stuff.
Jared, it has a certain poetic quality to it. You have to
does.
learn the nuance.
It is.
So it'll be on the bestseller list before it's all over. Rich, what say you?
I'm baffled that people could have such double standards and think it's perfectly all right. But I am really glad that the president decided he will voluntarily participate in this plan, even though he's not required to by law.
That's big of him.
But
with
the rest of us are. Imagine that. Only in America, as Don King would say.
Well, I mean, Stephanie.
Hold on. Okay, first of all, didn't he make like $300 million off of his last book? So even if it does apply to him, he has enough money to pay for his health care, whatever he should choose to have. But I'd like to say that this goes back to read the bill. I don't know, pretty basic concept. But, you know, the funniest part? They made sure that the union cronies weren't affected by this bill, but now they may be.
Well, you know, it's payback's a you-know-what. And that's all I got to say about that. But this whole thing was sold early on to us by basically saying that you don't necessarily have to leave your coverage if you like it. Now, of course, the law pretty much guarantees you'll hate your private coverage after it tries to compete against the public sector for about 6 to 18 months. So, you know, that's a little bit of a misnomer perhaps, but, you know, I just, the irony here is just beautiful.
It is. I mean, the FEHBP program works by having a number of insurance companies compete in it, and so there's a wide variety of plans that all these people can choose from. So it probably only affects a small portion of the employees at Congress. It probably does affect the congressmen because I would assume that they were the ones taking the richer benefits, and those are the ones that are going to actually be knocked away. But it is irony at the base level, and I really enjoy it. So, you know, it's good that they've screwed up their own insurance as much, at least in a little bit as much as they have.
Well, it screws up more people more than others, though, because the same laws don't necessarily apply. The health insurance benefits, government benefits, don't necessarily apply to lawmakers in the same way they apply to certain members of their staff. So, you know, it's almost as if we've set up a class envy on Capitol Hill now, which is another cherry bit. You know, that the haves. What do the haves do when all of a sudden the have-nots are now the haves, and the haves are now the have-nots? It's just very confusing to Alinskyeites, don't you think?
Absolutely. I like where they say we could try a legislative fix. Yeah. So your fix would then be to exclude you from the program? I would love to see that debated on the floor. I would really like to see that on C-SPAN. That would be absolutely special.
Well, wink, wink, nod, nod, I guess.
Well, on a good note, if this does actually apply to them, then, when they're diagnosed with stage 4 cancer and they're just told, you're going to die because you're too expensive, at least term limits may actually come into play. But, Herman Cain, well, it's true. Herman Cain said at SRLC, he said, he was diagnosed 3-4 years ago with stage 4, 3 different organs were involved, and he's like, if I had this health insurance policy then, I would have just been told to die. I'm not too upset if some of those people go.
I'm trying to visualize you right now as like a hospice caretaker, and I'm not seeing it.
I do work in the cancer field, and I feel for my cancer patients, but that's because my cancer patients aren't trying to legislate me having to pay for everyone else to have health insurance when it's not my job.
Well, and that's the thing, Jared, because you see this all day long because the field that you work in. I mean, how do you ever compete with Uncle Sam in a medical lab coat? That's the thing.
You can't, if Uncle Sam wants to not compete by the same rules, then you can't compete with him. You can compete as long as Uncle Sam says it's politically expedient for you to exist. But as soon as somebody comes into power that says, and maybe they're already in power, but as soon as somebody decides that it's politically expedient for them to vilify the industry, the health insurance industry, they can go and they don't have to fund it. They don't have to have enough money to pay for the cost out there. They don't have to worry about making sure that they have enough money in reserves. They can sell it at whatever rate they want, and they can pass on the hidden cost of maintaining this stuff, just like we do with welfare and Medicaid and Medicare and Social Security on down the road. And they've run everything else unfunded, so why would this program be any different?
Well, and that's the thing. I mean, ultimately, people don't understand the principles that Hayek put in place, F.A. Hayek put in place, when we forgot about him when, lo and behold, Keynesian economic policy started ruling the day in the early part of the 20th century, where he said that it is inevitable when you consolidate basically, when you consolidate the process into a smaller and smaller body of individuals, it's inevitable that at some point services are going to suffer. At some point, care is going to suffer. At some point, you have to take your options off the table if for the mere fact that you've got to facilitate all this. And how do you do that at that point when there are so few ultimately controlling the process and rendering the decision?
Right now, their answer is in September, already because of this, in September, Medicare is cut 21%. So, say you're an oncology office, about 40% of all their money, of all their patient money, comes from Medicare. So 40% of their business is going to be cut by 21%, and we already have a shortage of doctors. You know what? I say that anybody who votes and does the legislative fix, we just need to make sure they're out of office, because if you're not going to live by the same rules you give me, it's not do as I say, not as I do. Yeah. We're supposed to be Americans.
Well, the Department of Health and Human Services, Kathleen Sebelius just became the hottest date night in Washington, D.C. I mean, this woman pulls the strings for everybody, apparently, once this goes in full. All right, well,
and she's not a doctor, by the
way. No, she's not. Never worn a medical lab coat. Wouldn't even want to see her in one. Thank you for joining us. We'll see you tomorrow on The Hub.